All right, today we're diving into a really tricky dental problem. It's something that's often invisible, super misunderstood, and honestly can lead to a pretty frustrating dead end. We're talking about a complication that starts way down deep inside the tooth, a hidden story with some serious consequences. So let's get right into it. So let's set the scene. Picture this. You just went through a root canal. You did everything you were supposed to, followed all the rules, and you're just waiting for that sweet, sweet relief. But the pain doesn't go away. It's still there, this nagging ache that just makes you think, what on earth went wrong? It's a total mystery, right?
And that's the big question we're tackling. The root canal is done, so why does the tooth still hurt? Well, the answer is usually hiding where a normal X-ray can't see it. It's not about the nerve they just treated, it's about the very foundation of the tooth. So what's this culprit we're looking for? It's a hidden crack. And I don't mean a little crack on the surface that you can see or feel with your tongue. Nope. This is something way deeper and a lot more destructive. We are talking about something called a vertical root fracture. Okay, so what in the world is a vertical root fracture, or VRF for short? Well, it's pretty much what it sounds like, a crack that starts way down in the root of the tooth, deep inside your jawbone, and travels straight up toward the chewing surface. And that direction is so important. A typical cracked tooth breaks from the top down. A VRF, it splits the tooth from the foundation up. Here's a good way to think about it. Imagine your tooth is a building. A little chip on the surface, that's like a broken window. Annoying, but totally fixable. A vertical root fracture, though, that's like a massive crack in the building's foundation. You can't even see it from the street, but it's compromising the entire structure. It's just not stable anymore. And yeah, that brings us to the really tough part of this whole thing. Because when the foundation itself is compromised, well, you're kind of looking at a point of no return for that too. So here's the tough truth about a VRF. That little fracture line, it basically becomes a superhighway for bacteria to get deep down into your jawbone. This leads to an infection that you just can't clean out or seal off. The tooth has lost all its structural integrity, and because of that, there's really only one thing you can do, and that's extraction. And look, this isn't just one person's opinion. The clinical source material is crystal clear on this. It says, and I'm quoting here, VRF necessitates extraction of the tooth. There's no wiggle room, no maybe. It's a diagnosis with a very clear, very final outcome. You're probably wondering, how does something this bad even happen? I mean, do teeth just spontaneously crack from the root up? Well, not really. These fractures almost never happen in a perfectly healthy tooth. Instead, you can usually trace their origins right back to previous dental work, and that gives us a much clearer picture of what's going on. In fact, there's a specific word for this, iatrogenic. It sounds complicated, but it just means that the problem was an unintentional side effect of medical treatment. It's not about pointing fingers or placing blame, it's just about understanding that, hey, some procedures have inherent risks. So the source material points to 4 main ways this can happen during a procedure. First up, during the cleaning part of a root canal, the instruments can sometimes make the walls of the root a little too thin. Second, when the canal is being filled, if there's too much force, that pressure can push outwards. And the last 2 have to do with putting in a post, to support a crown. If the space for the post is made too wide, or if the post itself is too long, it can act just like a wedge and crack. It can literally split the root. Okay, So we've gone from a persistent mystery pain to a diagnosis to the potential causes. But what does all this mean for you? What's the real takeaway here? How can this info actually help you? Let's just do a quick recap. A vertical root fracture is a serious, deep crack in a tooth's root. It's a known, though not super common, complication of some dental work. And unfortunately, once you have one, the tooth has to come out. But here's the key. Just knowing that this is a possibility is the first, most important step to being a really informed patient. And that really brings us to the final and I think most important point. The goal here isn't to make you anxious about going to the dentist. Not at all. It's to empower you. So the real question to walk away with is this. As a patient, what questions can you ask to be an active partner in your own dental care? Because when you understand the process, you can navigate your own health journey so much better. Thanks for digging into this with me today.